WinS Network and WaterAid. Before we begin, please note that the session is available in either English or Portuguese through the Zoom interpretation function. Please choose your preferred language by clicking the globe icon below. And the detailed instructions you may also find being shared in the screen, on the screen in Portuguese. So should you have any questions on how this works, please feel free to type that in the chat. And also, please introduce yourselves in the chat by putting in your name, your organization, and where you're joining us from. So this session for today is entitled Advocacy During a Pandemic, Country Experiences on WinS Monitoring, Fundraising, and Strategy Development. So I hope my colleague can put up the... All right, yes, thanks a lot. And all right, so if you have joined us in any of the first three sessions, welcome back and thanks for being here with us once again. Please be reminded that this session is going to be recorded and made available via the WinS Network website. By staying on this call, we understand that you consent to this to being recorded. I'm Marge Lim of the WinS Network Secretariat, and I have the pleasure of opening the session for today with a brief introduction of the WinS Network. I'm also joined by my colleagues and partners, Piata Mendova from GIZ and Maya Igarashi Wood from WaterAid, who has been strongly supporting the coordination and preparation for this event. Over the next hour and a half, you may see either of us posting reminders, links, etc. in the chat. Now, please allow me to take a few minutes to introduce the WinS Network and to provide an overview of the webinar series. The WinS Network is a global interagency network that is working towards the improvement of WASH services in schools across the globe. And in order to do that, the network facilitates exchange of experiences and alignment of strategies among various organizations to support government's WASH in Schools programs. The network is steered by the core group members, namely UNICEF, GIZ, Save the Children, WaterAid, the WHO UNICEF Joint Monitoring Program, or the JMP, the London School of Hygiene and Tropical Medicine, Emory University, and UNESCO. The Network's activities are focused on various working streams, which you may see on the screen, that the blue box there, namely advocacy policy and system strengthening, monitoring and reporting, research and evidence building, gender, including MHH, WINS programming, and knowledge management, capacity development, learning, and exchange. If any of these initiatives is of interest to you or is aligned with the work that you do, we cordially invite you to continue exchange with the WINS Network either as a member or a partner organization. What this means is that you will be part of our mailing list and you will receive regular updates on the WINS Network's activities. If there are events such as what we have today, there will also be calls for contribution, thereby providing a platform for you to share best practices within your area of work. On the other hand, there is no active engagement required, but would of course be most welcome. You may check out the website winsnetwork.org. Again, that's www.winsnetwork.org for more information. On the website, you may also find upcoming and past events on WINS and a collection of relevant materials and information about WINS, including global guidance documents or resources, publications in peer-reviewed journals, and the Washington Schools and COVID-19 Knowledge Map. If you have any question, please feel free to place them in the chat and we will address them as soon as we can. May I request a... Yeah. All right, yes, thank you. And I will also post the link to the member registration form for those who would like to become a member of the WINS network. Next slide, please. At this point, I will now move on to the next segment and turn the virtual stage over to our session moderator. Please allow me to introduce Belinda Abraham, who will guide us through the informative and interactive session ahead of us today. Belinda is an American national and international development specialist with over 25 years experience in the WASH and education sectors in sub-Saharan Africa and Southeast Asia. She has worked with UNICEF, GIZ, and several international NGOs in 7 countries. Belinda is currently based in Berlin, Germany, supporting the Global Washington Schools Network Secretariat and also Viva Conagua on institutional fundraising for their projects in Africa and Asia. Without further delay, I now pass the virtual mic over to you, Belinda. Thank you very much.
Great, thank you. I hope everybody can hear me and everybody can see me. I think there might be, just before I begin, and thank you very much, Marge, if I can just ask just to go through again, just so people know the proper, we have two languages today. Fortunately, we have English and we have Portuguese. So just to be on the side, please go to the bottom of your screen. You'll see a global icon. In the global icon, you can choose Portuguese or you can choose English. And if you're having problem, you please go onto the chat box and one of the team members can help you. Okay, because I understand some people are having some difficulties. So with that, can you kindly go back to the screen, Piata, for me, the presentation? And I'd like to welcome everybody to this webinar. Great to see all of you here. Next slide, please. And we are actually quite honored today because today is about a month ago, it was Africa Day. And so I think almost in commemoration of this, it's great to have that our 3 speakers and our 3 countries today are featured on Africa. And I'm very pleased to introduce Miss Ellen Jejeke. She is a school health education program officer. She works proudly in the Ghana Education Service. And she is a Ghanaian national, as well as currently is handling a lot of the water and sanitation programs. She is doing gender sensitive curriculum, teaching aids with health. She's training the school health and education coordinators on hygiene education in schools. She has been promoting hand hygiene and also was involved in establishing the national standards for school wash and also the national costed strategy. Besides that, she comes very educated from Holy Child College, as well as a Bachelor of Education in on Home Economics from Winneba, and also health education. I apologize, there's a little bit of challenges with my internet, but I hope you can all hear me. And from the University of Cape Coast. So with that, I would love to introduce Ellen, and if Ellen can be pinned as well as myself. Presently, I don't see it. Yeah, and I will share my screen. Great. So I just need a hands up that everybody can see the screen, because right now it is not pinned for me to see. Yeah, so thank you, Meva. Great. And just hands up, you can hear me in English? Okay, great. And great. And you can hear in Portuguese. Perfect. Okay, Ellen, welcome. Ellen, are you with us?
Yes, I'm with you. Thank
Welcome,
you.
Ellen. Thank
Thank
you.
you. And
Yes.
good morning to everyone.
Good morning. Great.
I,
So this is moving along. I just, we have what we have in front of us now is a picture presentation. So I wanted you to maybe talk to us a little bit about the school health education program. And particularly what I'm interested in is basically what is the enabling environment for Washington schools in Ghana?
okay, thank you, Belinda, for the opportunity to be part of this webinar section. The Ministry of Education through the Ghana Education Service is committed to creating the enabling environment to enable our learners achieve the highest educational potential. In view of this, policies formulated and programs implemented in schools are aimed at giving the nation's children the necessary knowledge, skills, and values to enable them lead happy and productive lives. This is in recognition of the value of education as a key strategy for the advancement of gender equality, promoting opportunities for all, and overcoming barriers for vulnerable groups. Currently, Ghana has developed a national school health policy guidelines. This was developed in 2012, which is going to be reviewed pretty soon, which provides the framework for implementation of health education activities, including WASH in schools. So WASH in schools falls under the general school health education program in Ghana. The SHAP policy guidelines is also in consonance with the requirements of the Education Strategic Plan of 2018 to 2030, which enjoins Ghana's education system to provide equitable long life quality education to children and young people of Ghana. This also ties in with Ghana's commitment to the Sustainable Development Goals 4 and 6. The government's commitment to WinS is seen in various national programs and projects like the Community Water and Sanitation Agency programs, supported programs, the Canadian programs, the Netherlands, the Denmark, the World Bank, water and sanitation projects, and water aid, and the rest. And it continues with INGOs to achieve the full coverage and services of Ghana. By this, Ghana has developed national minimum standards and implementation models. This was developed in 2014 with technical and financial support from UNICEF. And these standard documents give direction to implementation of WASH in schools in Ghana. And the standards give specifications for gender-friendly toilets, which is supposed to be separate for boys and separate for girls with a changing room for girls, and also makes provision for disability-friendly rails and ramps, and age-specific as well, because the kindergarten is part of the primary school. The models also look at empowering children to become effective change agents. This includes formation of school health clubs, children and youth ambassadors for WASH, children's involvement in community-led total sanitation, etc. There is also a comprehensive program on menstrual health and hygiene. So educational materials have been developed and a guidelines has been developed to be used as reference materials for MHM implementation in Ghana. And this document was launched in 2021 during the commemoration of the Menstrual Hygiene Day. All these interventions also target the school community because the school is an integral part of the community. And therefore, if we leave them out, implementation will face certain challenges. So we involve the Parent-Teacher Association and the school management policy. I wish to conclude by saying that government of Ghana's education policy aims at not leaving any child out. Thank you.
Yeah, thank you very much for that comprehensive overview of the enabling environment in Ghana. And for many of you who can see on the screen, a lot of the documents that were put, those minimum package guidelines that you mentioned, the checklist, and now increasingly the IEC materials are being shown on the screen to really highlight the level of work and engagement at that of the level of policy, which is fantastic. So now moving on to a second aspect is, how is the implementation arrangements? And I just actually have a quick question. So during the COVID pandemic, did you have additional guidelines? This is just a quick additional question, Helen. Did you have,
Yeah,
you did have
the Ghana
additional,
Education Service developed guidelines for schools before they reopened, just to ensure that and assure parents that the children are safe whilst in school.
okay, okay. But I can imagine many of the documents that you had before were very much supporting that process as well. So
Yeah,
yeah. So the second question I have is around implementation arrangements for WinS. And how is it coordinated amongst sectors like health and water in the case of Ghana? How is the implementation? Because that's often the challenge, the coordination
yeah,
and implementation. Can you share a little bit about
yeah,
that?
yeah. In Ghana, SHEP is School Health Education Program, and it is a collaboration between the Ministries of Health and Education. And because the Ministry of Education, we have the children, we have been given the lead role. Aside the Ministry of Health and Ghana Health Service, we collaborate with relevant state institutions which help to provide technical support to the Ghana Education Service. So within the SHEP implementation, our program is delivered through the national office. So for instance, we have at the national office where I am, we have a director and program officers for the different program officers. At the regional office, we have the regional director of education, who is the head of the region, and the regional school health coordinator, who supports with coordination of health education activities at the district. At the district level, it is the same, the district director and then the district chef coordinator. Then at the school level, we have designated school-based health coordinators who see to the day-to-day running of health education activities, including washing schools under the supervision of the head teacher. The SHEP unit has also constituted a national SHEP steering committee with members from health, education, sanitation, gender, and local government ministries. Besides that, there are representatives from development partners and civil society organizations. This committee meets quarterly to contribute to discussions on effective health education delivery in Ghana. In recognition of the key roles of the stakeholders, the policy, SHEP policy, also requires that the ministries, departments, and agencies also constitute SHEP steering committees at the district level, who will also have oversight responsibility of health education activities at that level. The district assemblies also have been mandated by the Education Act 778 to constitute District Education Oversight Committee. This committee is chaired by the district chief executive, and the district director of education is the secretary, and they meet regularly to contribute to the totality of education delivery at the district level. Under menstrual hygiene management, we have constituted a national technical committee which also sees to the effective delivery of MHM in the schools and the community. And the membership also consists of government, development partners, ESOs, etc. And all these have contributed effectively to our implementation of WASH in schools in Ghana. Thank you for now.
Thank you, Ellen. And that was very, very comprehensive. So what I understand is basically we've got national structures, which are a coordinated body. And basically this is replicated all the way down to from
The
district
school level.
to down to
Yeah.
school level. So you've
Yeah.
got this actually, no, I wouldn't say like almost a mirror system, but cascading all the way down. Very interesting.
Yes.
And
Yes.
again, linked to the pandemic, were these the very same structures that were used as well in terms of the preparedness, or were there different structures that were used for the pandemic preparedness?
It is the same structures that were
Uh-huh.
used for
Okay.
training of teachers. So for instance, we trained the national team, and then the national team trained the regional team, which was headed by the regional director of education with stakeholders
Mhm.
of education. The same was done at the district and then the school level.
Okay. Yeah, very nice. And yes, we must say that at various levels, then partners such as NGOs, private sector are also
Yeah,
involved. Yeah,
yeah,
okay.
yes, yes.
Very clear. So with such a structure, how then is WinS monitored? WinS monitored. Is that using the similar structure, or do you have another structure for monitoring WinS? So can you explain a little bit about how WinS is monitored, and a little bit? I'm interested also, how is the data used?
Okay. Thank you, Belinda. So in terms of monitoring, we have some partners supporting the schools in some regions. So we monitor those project activities, and government also sometimes make provision for funds to monitor the general. So it's like a comprehensive school monitoring. When we go, we look at everything about the school. And we have developed a structured checklist, monitoring checklist. The checklist forms part of the minimum standards, which has been shared with the schools from, in fact, from national, regional, district, and school level, which we all use to monitor WINS activities at the school level. When we go on monitoring, sometimes there are issues which need immediate attention. So when we need to meet with the district chief executive, we visit him and give him feedback on what we have seen. Even it is a donors project and there are some concerns, there and then we visit and give them feedback, and also give the directors of education also feedback. And then when we come back, we write a comprehensive report and share with Ghana Education Management to also make informed decisions. And all these contribute to improve educational outcomes. The Ministry of Education also has an Education Management Information System, EMIS, which captures comprehensive data on schools. And the EMIS also tracks the availability of school wash facilities as well. Thank you for now.
Yeah, thank you, Ellen. So that's very comprehensive. So, no, so then you say the data is used. So when the data is used, it goes back, and then sort of corrective measures are made.
Yes, please.
Okay. I'm curious too, and maybe perhaps I'm also opening it up. The chat box, we'll open it up for others to ask questions. But have you linked it with the EMIS data? When you talk about the data being used, is it linked with the Education Information Management System, or is this a separate
It's a
WINS monitoring?
separate,
Okay.
separate. The Education Management Information System is a unit under the Ministry of Education, which conducts annual school census. So at least when they go on to the schools, they look at the number of schools with toilets, the ones which are functioning, number of schools with water, and the rest. And all these are used to make informed decisions about washing schools
Mhm.
by all stakeholders. Thank you.
Yeah, thank you, Ellen. Yeah, it's very interesting because there's often this discussion of whether it should be integrated or it should be separate. But I think having a separate system in the case of Ghana allows for, I would say, reiterative. So if there is problems, they can be addressed, and it's sort of and
Yes.
going through that system again. So it's quite interesting. But love to hear from others on their thoughts of that. Um, so with such a system, what kind of capacity building efforts exist for WINS? We saw the documents that you showed earlier, the school health guides, the teachers' guides. But can you maybe elaborate a little bit more on the capacity building efforts?
Okay. Thank you, Belinda. Um, the Ghana Education Service already have an existing training structure. So, for instance, we have the national team consisting, if it has to do with school health, as our officers from the national office and Ghana Education Service, as well as partners from the other MDAs and probably some CSOs. When it comes to the regional level, so the national normally trains the regional training team, and then the regional training will also cascade to the district to train a district training team. And then the district will now zoom into the schools, depending on the geographic of the district. They will either consider to have a cluster training or which anyone which works for them. They devise that to have their capacity building for our school-based health coordinators, the school children and teachers. And then, even as part of the training, since the school is an integral part of the community, sometimes we involve SMC members so that when decisions are taken, they can support the schools to implement it. Aside that, the Ministry of Education also has a National Teaching Council, which is also responsible for promoting standards amongst teachers. So we have engaged them. We want to incorporate some of our training models into their trainings so that when teachers are being trained over there, it will be captured and for them to use it during teaching and learning in the classroom. Thank you.
Yeah, thank you very much. So it's very interesting that there is so much investment actually in the capacity building and the training down to
Mhm.
teachers level. So I'm sure there'll be lots of questions with that. But moving us along here, the question then I will have is on budget. And if you can maybe briefly elaborate on whether there's a standalone budget and how did, like in the case of the COVID, was there additional budget released by central government for WINS? Can you share a little bit about budgets?
Okay, thank you. You know that washing schools falls under the school health education program. So we don't have a separate budget for washing schools. It falls within the broader budget of the unit. At the height of the COVID-19 pandemic, the government of Ghana made funds available for training of teachers. And PPEs such as hand washing facilities, soap, hand sanitizers, face masks were supplied to the schools just to ensure that staff and learners were safe for academic work. Schools were also fumigated to provide form of protection. This was also to assure parents and guardians that their wards were safe in school. With the current successful management of the pandemic, there is supposed to be increased budget allocations that is yet to be sustained. And COVID-19, in fact, as part of our trainings these days, at least, we have introduced the protocols into our training just to ensure that at every training, this will be done, and then it will serve as a reminder to our staff and learners. So briefly, thank you.
No, that's actually very, very interesting point that you made, that actually it has, if what I understand, there has been not only has the COVID-19 has improved in terms of the training and preparation has been integrated in that, but as well that there is also additional budget. So I guess maybe just to wrap it up, because I see that we have a slightly going up on board, and I want to give people also the opportunity to ask questions. The last one I just wanted to say is, if you kind of reflect on, I'll give you two reflections. One reflection on sustainability and in terms of Washington schools, and then another reflection, if you can, on the COVID pandemic, its influence, whether it's challenged or improved the situation. So on one side, can you give a bit of a reflection on the sustainability of Washington schools? Because we see the structure is there and it's very, very solid, the structure, but I'm sure the questions are always around, operation and maintenance, sustainability in school. So maybe some reflections from you on that. And then also, has the COVID-19 pandemic improved or challenged the situation in schools from your point of view? I'm asking all the presenters that, so thank you.
So thank you, Belinda. And it's been wonderful being on this webinar. The primary challenge for Washington Schools implementation is inadequate funding support for the program. We all know that construction of 2 toilets is very expensive, as well as provision of water and the rest. So in fact, we need additional support to reach all schools across the country, and also provision of the physical facilities. Another challenge is operation and maintenance. We realize that in communities where the households don't have toilets, that of the school become theirs. And you know that the facility has been provided for a specific number of children to last a specific number of years. So when they share with the children and cleaning becomes a problem, they deprive the children access. So it is a very big challenge. Schools are given capitation grants to run the day-to-day activities of the school. And once the head teachers assess the grants, they prepare school performance improvement plan. The plan is a guide to disbursement of the grants. And something small goes into sanitation and minor maintenance. And the district assembly has the oversight responsibility of school toilet infrastructure and major issues relating to operation and maintenance. So when it becomes necessary, we fall on the assembly for support. In terms of COVID-19, COVID-19 has re-emphasized the importance of adequate and permanent physical facilities for WASH, especially at the pre-tertiary level. For instance, at the height of the COVID-19 pandemic, government responded by providing Veronica buckets. Veronica buckets is a type of hand washing facilities. And one thing the pandemic has taught us is the need for permanent hand washing facilities, because it was done in a rush. So we need permanent, solid hand washing facilities which will last for long. On the other hand, hygiene behavior has also improved significantly during the pandemic. And this has generated the impetus for the finalization. Ghana has developed a hand hygiene strategy as a result of the COVID. And hopefully this will go on and will help to sustain, improve hand hygiene practice, especially among our learners. Thank you, Belinda.
Thank you, Ellen. Such great comprehensive answers. And it really gives you a feel of the work that you're doing, the work the partners are doing. I do have one question, and owing to time, we can only take one, but we do welcome others to put it in the box. But I will take the one question because I do think it's a good one. So it is from Meva. Yeah. So Meva, you can do you want to unmute yourself or do you want me to read it? I don't. I can read it if you want, but you're also welcome
Please,
to.
please read it. Sorry, I'm in the
Oh,
place where, yeah, there is a lot of
okay, no
background. So
problem,
sorry
Mava.
for
But
that. Yeah,
thanks for your
yeah.
questions.
Thank you.
So
Yeah.
yeah, so Mava says thanks for the comprehensive presentation, and she asks, do the monitoring tools um, do the monitoring tools separate are separate from other educational tools? And you responded yes, but how is it used practically and how to sustain the monitoring system? So she's clear that it's a separate WinS monitoring tools. So how is it practically used and how can you sustain this? Mhm. Can you, yeah,
Thank you.
yeah. Yeah. You got the question, Ellen?
Yes, I
Yeah,
did.
perfect, perfect.
So we have uh, within the school health implementation, we have a checklist which tackles every aspect of health education. And then when it comes to WINS, because the minimum standards was developed based on the national minimum standards for washing schools, we have the checklist for the washing schools. As second supervisors, also have at the district level, also have a checklist which captures everything from classroom, teaching, learning, everything including health of children in that their checklist. And then NASIA is National National Inspectorate Authority of the Ministry, National Schools and Inspectorate Authority. They are responsible for monitoring and ensuring standards in the schools. They also have a very comprehensive checklist, which also looks at everything of the school child, everything which will see to the safety of the child, academic enhancement, and everything. So that one also is very comprehensive and has everything about education in it. Thank you, Belinda.
Yeah, thank you, Ellen. And I think if I leave, kind of the reflections from Ghana, I know the work is quite a bit, and it's challenging, and the situation isn't challenging, as you mentioned, the situation of robust facilities in school and access, especially in the remote schools. But one thing I do think is this viewpoint that I see is this comprehensiveness, and you talk about it comprehensive in terms of health. School health is not just seen as a one linear, it considers a lot of things. So the comprehensiveness and also the comprehensiveness in partnerships when you talk about the different levels also. So it's kind of the lasting kind of message that I got from this presentation. Ellen, thank you so much. And on behalf of the director and others, we thank you so much for being part of this webinar. And please stay on because I'm sure there's still questions on the box for you. And maybe Marge and others can forward them or help forward them so that you can answer them. Again, thank you. And congratulations to the team Ghana for their
Thank
work in
you.
Washington schools and being Washington school champions. Thank you.
Thank you, thank you for the opportunity.
Great. So then now we're moving on. So going across the continent and now we go to Mozambique. And so if I can ask for the slide to be put up. And yes, oh, sorry, a virtual applause. We must all give a virtual applause to Ellen. Thank you. So thank you very much. So now we go to Mozambique and welcome Mozambique. We would like to introduce Dr. Arlinda Chakwiza. Apologies if I'm not pronouncing it well. I'm struggling a little bit today with the beautiful language of Portuguese. She is a general practitioner of 21 years with a master's degree in tropical medicine, international health, and she has a clinical practice, or she's involved in a clinical practice in the Central Hospital of Nampula, and she's involved in internal medicine, pediatrics, gynecology, obstetrics, and also takes care of chronic patients. So she really is coming from a very strong health background as a doctor. She's also the director, or was, excuse me, previously was the director of the Health Science Institute in Nampula and the head of the training department in the Provincial Directorate of Nampula for 10 years. Since the last 7 years, she is now the National Director for Nutrition, School Health in the Ministry of Education and Human Development. And with the outbreak of COVID-19, she was super busy, I can imagine, and just reading her the work that she did, and I think, you know, really Mozambique was in great hands having such a professional. She was responsible for the response within the education sector and also was involved in the multi-sectoral response for COVID-19. So we are very honored and pleased to introduce Dr. Alina Chakwiza, and welcome.
Bom dia a todos.
Very good morning to you all,
Obrigada pela oportunidade
and
que
thank you
foi
for
dada ao
the
Moçambique
opportunity
para poder
given to
falar
Mozambique to
bocado
be
sobre
able to talk a
a
bit
questão
about
da água e
the issue of
saneamento
water
nas
and
escolas no contexto
sanitation
da
in
Covid.
schools in the context of COVID.
Estou aqui
I'm
representando o
here
Ministério
representing
da
the
Educação e
Ministry of
Desenvolvimento Humano
Education and
e
Human
faço-me
Development,
acompanhar por
and
alguns
I'm
colegas
accompanied by some colleagues
do
from the
próprio
ministry
Ministério da Educação e também
itself,
outros
and
parceiros
also by
que
partners
intervêm
involved
nesta
in the
componente
water
de
and
água e
sanitation
saneamento nas
component in
nossas
our
escolas.
schools.
Dada a limitação do
Given
tempo,
the limited
se
amount of
quisermos
time
fazer
we
uma
have,
apresentação muito
I will
breve
make a very brief
para
presentation
tentarmos destacar
and try and
alguns
highlight some
aspectos
aspects that we
que
think are
julgamos
important
importante
to share,
partilhar, pese embora
even
haja
though there is a
muita
lot of
atividade ou
activities or
muita ação
actions that
que se
were
levou a
taken
cabo durante a pandemia
during the
do Covid.
COVID
Próximo
pandemic.
slide, por favor.
Next slide, please.
Em jeito de
By way
introdução,
of introduction,
nós poderíamos aqui
we could
dizer
say that
que
during COVID-19
durante a Covid nós tivemos que,
and at all
no
of
nível
our
do
education
nosso
system,
sistema de ensino, definir
we had
algumas
to define some
estratégias
strategies
para evitar que
to
a
prevent
escola também
schools from
constituísse
being a place
local
of
de transmissão ou
transmission and
contaminação
contamination
do
of
Covid.
COVID.
Por outras palavras, gostaríamos de dizer que
In other
tivemos
words, we would
que
like to say that we had
dobrar
to
as nossas
double
ações
our actions
no sentido de
to ensure
garantir
that
que elas
schools
continuassem
remained
sendo
safe
espaços
spaces
seguros
for
para que as nossas
our children
crianças pudessem
to live in a
conviver num
healthy
ambiente saudável
environment
e, de certa
and
maneira,
somehow
poderem
prevent
evitar a
transmission of
transmissão
this disease
desta doença que
that has done so
tanto
much harm
causou em todos
to
nós.
others around the world.
E para tal, era importante nós
And for
olharmos
this,
aqui a
it was
questão
important
da
that we look at
higiene
the
do
issue of
alimento
hygiene and
como
sanitation
sendo o elemento
as a very important
importante
element in
no
the
contexto
context
da
of preventing
prevenção da própria
COVID-19
doença.
itself.
Quando nós
When we
tivemos
had
o primeiro
the
caso
first
no
case in the
país,
country,
o presidente
the president of the country directed us to I can't hear anything.
Mas neste período de encerramento
But in
das
this, during
escolas,
this period
era
of closure,
importante que nós,
it was
no
important
nosso
that
país,
we as parents
e nós como
and
país,
as
nós como
education
setor
sector
da
could
educação,
define strategies
pudéssemos
to enable
definir estratégias
a
para
safe,
permitir que o
a safe
retorno dos
return
alunos
of
à
students to
escola
school
acontecesse de
and
maneira
also that
segura
students could
e que
continue
também durante esse período de encerramento das escolas,
to
os
study from
alunos
home.
deveriam continuar a estudar a partir de casa. Por isso
Therefore,
foi
a
aprovado o
multi-sector
Comitê
committee
Multissetorial
for
para a
COVID
resposta à
response
Covid.
was
Este
activated.
comitê multissetorial
And this committee
era
was
coordenado
coordinated
dentro do
by
Ministério da
the
Saúde,
Ministry of
e no
Health
qual envolvia diferentes
and involved
ministérios,
other
no qual também o
ministries,
Ministério da Educação
including
fazia
Ministry of
parte.
Education,
E
was
neste, e
part of
neste
this
comitê
committee,
nós
and we discussed
discutíamos
all the
todos os assuntos
important
importantes
issues to
para
ensure
conseguir
safer
efetivar
return
o
to
retorno à
school.
escola de forma segura. Para tal,
To this end,
criou-se, aliás, elaborou-se
the community response strategy to COVID was developed,
a estratégia comunitária de resposta à Covid, e
and
também
also
a nível
at the
do nosso
level
setor,
of
nós
our
tivemos que
sector,
definir
we
e
had
criar
to
alguns instrumentos
define and create some
para podermos fazer
instruments
a
to be able to
verificação
verify
das escolas, verificação das
conditions in our
situações
schools
nas nossas escolas
so that
para
student
que o retorno
return
fosse
could be
seguro,
safe.
mas que esta verificação
But this
tinha um
verification has a
elemento muito
strong
forte
component
ligado à
of
água
water
e
and
saneamento.
sanitation.
Ah, e para tal, nós
And
tivemos,
for this, to
aliás,
this
o
end, the
governo
government
criou
set
grupo
up a
específico
specific group
para poder
to
verificar
be to verify the
as condições
conditions
que as
that
escolas tinham
schools had
para permitir
in
que as
order
escolas
to allow
pudessem retomar quando
classes to
houvesse
resume
orientação
when
presidencial.
there was
Este grupo de
special
verificação
guidance. This
era
verification group
composto por
comprised an entity
entidades
linked to
ligada
school
à
inspection
inspeção
or
das
school
nossas
oversight,
escolas e
and
também pelo
also by
próprio
the
Ministério
Ministry
da
of
Saúde.
Health.
E existia uma ficha,
And there
e essa
was a
ficha
form that need
deveria
to be
ser
completed
respondida
to
para
verify
poder
whether
saber
or
que a
not the
escola está em
schools
condições
were
para
in
poder retornar.
good conditions
E também
for a
nós
safe
produzimos
return, students'
muito
return.
material de
We also
informação.
produced a lot
Era
of
importante
communication material.
informar os alunos, informar a
It was
comunidade
also
escolar
important to inform
sobre os
students
perigos
and school
desta
community
doença,
about the dangers
sobre
of
as
this
medidas de
disease,
prevenção deste
about the
perigo
measures to
e
prevent
também
it,
sobre
and
os
about the
cuidados
additional care
adicionais que
that
deveriam,
should be
que
taken
deveriam
to
ser
avoid
feitos para
contamination
evitar
in our
a
schools
contaminação nas nossas
and also
escolas e também
outside school.
fora das nossas escolas. E também nós
We
criamos
also set
um
up a COVID
programa
case
de
management
gestão de casos
flowchart,
da Covid, que era para
which
permitir que
had to
quando houvéssemos
enable
situações de casos nas escolas, a comunidade escolar, o diretor
the
ou o
community
professor, em
access to
cooperação com as equipes de saúde,
manage
pudessem
COVID
tratar
cases.
deste caso
The
sem
head
criar
teacher could, in
alarido
coordination with the health teams, be able to handle these
mas
cases
também
without
neste
creating
processo que nós
much
tivemos
fuss
que
within
fazer
schools itself.
para
But
garantir
also
o
in this
retorno
process,
às
we had
escolas,
to do
vimos que
we had to
deveriam haver
ensure a
intervenções
safe return to
específicas
schools,
nas
and we
próprias
saw that
escolas,
interventions should be
porque o
made
nosso
in the
país
schools
tem uma
themselves,
rede de
because
cerca
our
de
country has a
10.000
network of
escolas
about
primárias
13,000
e cerca
primary
de
schools
700
and
e
about
67 escolas
677 secondary
secundárias,
schools.
e era
And it
necessário
was
que
necessary to
todas
see
essas escolas
if all these
tinham
schools had
sanitários já a
functioned
funcionar, se
toilets,
tinham
if they had
água
running
corrente
water
ou água
or
através
water
do
through
tubo de reservatório.
reservoirs.
Feito este levantamento,
Once
houve a
this survey
necessidade
was done, it was
do
necessary
próprio
for the
governo
government to intervene,
governo poder intervir, porque viu-se que havia
because
necessidade
we
de
realized that
garantir
the need
água
to
e de
guarantee
garantir
water and adequate
saneamento
sanitation. There
adequado
was
nas
a need to
nossas
guarantee
escolas.
water and
Por
sanitation in
isso,
our
através
schools.
do Ministério das Obras
Therefore, through
Públicas
the
e
Ministry of
ligado ao
Public
governo,
Works
que lida
and
com a parte
Housing,
da
which is a
construção,
government entity
nomeadamente
that deals with the issue of
da
construction
distribuição da água,
and also with provision of
fez-se esta
water.
intervenção
This
em
intervention
várias
was made
escolas.
in several
Criaram-se
schools.
pontos de
Hand
lavagem
washing
manual
points
nas
where
nossas escolas
stations were
que
created in our
reabilitaram-se
schools.
os
The toilets
sanitários,
were toilets were
construíram-se
rehabilitated
outros sanitários
and the
e foi
toilets were
aplicado
built.
para
And it
podermos
was important
garantir o retorno seguro.
to ensure
E
a safe
também,
return to
para
school.
além de
Logically, in addition to the construction and provision of water, it was necessary that the process of management or use of this infrastructure could be done properly. So it was necessary to produce a lot of information so that this work could be developed properly. Also, we produce norms and procedures for hygiene and cleanliness, which was meant to know schools and also how to ensure that children using the toilets knew where to put used paper, toilet paper, and other materials that they could use. But also due to all these interventions and the need to strengthen hygiene measures in our schools, it was also necessary to strengthen financial resources. There was an increase in the budget for schools to ensure hygiene, cleanliness, and also to make available available products for individual and collective hygiene in schools. Everything that was important to allow children to have the opportunity to wash their hands, disinfect their hands, and be able to be in clean spaces, because it was important to disinfect the classrooms, toilets, to clean toilets regularly, and even had with support of various partners to provide thermometers to allow the control for temperature upon arrival at school. Uh, uh, and yes, we had to ask different partners to provide us with the necessary materials to achieve our goals. Because of this, we also couldn't live, we couldn't neglect the issue of menstrual hygiene. So there, here we had to develop a menstrual my hygiene management kit comprising pads, soap, and powder, soap powder. And as far as possible, we're distributing this in our schools. Partners who worked with us in this component helped us a lot to allocate our schools with these kits. We have some toilets that we built in a very specific way on this issue of menstrual hygiene, which even have is, have we have incinerators to destroy uh, sanitary pads, and where girls can change during the when they remain at school in their periods at school. It was and we also had to draw up a develop a contingency plan to be able to respond to all these needs. And we had the great privilege that when COVID broke out in our country, we produced a response plan that was submitted to global education partners that also funded about $15 million, which helped a lot in preparing our conditions during the period when classes were school was closed, and also ensure the safe return of students to school. Another important aspect that we did and we are still doing today, is the monitoring, school monitoring. These are support monitors to help the schools to overcome some constraints that they may have, because we are aware that the financial resources allocated to schools are insufficient. So we have to develop strategies, seek more partners to so that we can respond to these needs. So in a very brief way, and because we could be talking a lot more about interventions that we have made in the context of COVID in this component of water and sanitation. And we might have to say that we most important thing is to say that we are doing permanent monitoring. We have materials produced in different ways, and we have a strategy that is within a script, which is the teacher's agenda. The subjects related to water sanitation, hygiene, cleaning, menstrual hygiene management, COVID prevention are part of this teacher's guide, which is actually a teacher's agenda that she should use throughout the year to make the necessary notes. And there is also the school calendar and the important information for the school, for the teacher. And this is where I stop, considering the time limitation, and I thank you very much for your attention.
Thank you very much. Obrigado. Very much. Thank you so much. I think again, I leave with some reflections on, I would say, equally comprehensive, but I would also add coordinated and thorough uh, in the approach for COVID. And I'm going to ask you a couple questions, um, Dr. Alinda, I'm going to ask you a couple questions. I hope you can hear me. You had alluded to the challenges of sustainability, and I just wanted you to talk about, yes, there's sustainability, but what sort of measures is the government trying to do to address it, from your perspective? Um, did you hear the question? I don't know if the interpreter can help me or if you can hear me.
Well, this issue of sustainability is a very serious problem. COVID came along, surprised us, but also awakened us to many aspects that we were not paying enough attention to. We are talking about the issue of actual conditions that our schools have, especially the issue of water and sanitation provision, as well as the issue of security in general. And until 2 years ago, the government did not intervene in the issue of security in our schools. This was a school's responsibility, where the school councils and parents and guardians contributed and identified people in the community to be guards, and also to support the cleaning of our schools. But given the situation of COVID, since last year, within the state budget, a budget line has already been identified for the hiring of guards and assistants for our schools. This is a gradual process, taking into account what our limitations are. And as in the country, and little by little, year after year,
abrem-se concursos para desenvolver essas
calls for
pessoas
tender
e vão ajudar na
there are
segurança, na
calls for
limpeza
tender
das
to hire
premises
these
escolares.
people who will be helping in the security and
Também
cleaning
tem a
of
ver com as
school premises.
construções. Em algumas vezes,
Another issue also has to do with
as
buildings. In some
construções
cases, the
não
constructions did
obedeciam
not comply with the
corretamente aquilo que eram
sanitary
número alunos
ratio versus school
número
students.
sanitários versus número de
But a
alunos na
model,
escola. Mas foi
but
aprovada uma
modern
planta
plan was approved
que esta planta tipo
that
já
already
prevê a questão
um,
de construção
provides for
e
this
o número
construction
mínimo de
issue and
sanitarios para
minimum
determinadas
number of
escolas,
sanitary
até para ajudar
facilities,
a
toilet facilities
minimizar
for
a
some
minimizar aquela
schools.
questão da latrina, uma latrina masculina, outra latrina feminina e por aí fora.
At
E
a
essa
male
situação
toilet
nas
and a female
escolas
toilet, for
eu
example.
disse há pouco tempo. Agora, em termos de
In terms of
reforço
budget
orçamentário, esse é um assunto que ainda
strengthening, this is an
leva
issue that
discussão,
still takes a long time to be
porque
discussed because
com a construção
with the
desses
construction of these
sanitários e
toilets
a construção dos sistemas de
and water supply
abastecimento,
systems,
logicamente aquilo que é
logically, what is
despesa na
spent
escola
on the school for the
para
provision
prover
of these
esses serviços
services
aumentou.
has increased.
Mas esse é um assunto
But this
que
is an issue that will
ainda
still
leva
take a
muita
long time to
discussão,
be discussed
porque os orçamentos
because we know
das
that the
escolas
budgets
sabemos
allocated to
que
schools
nós
are not
sabemos que
sufficient.
não são suficientes, mas
But in
paralelamente a
parallel to
isso,
this,
o que nós
what we
tentamos
try to
fazer
do to
para garantir
enable
que de uma forma
enable
sustentável
us to have
nós
water in our
tenhamos água nas
schools in a
nossas
sustainable
escolas
way
é a
is
questão
the issue of
da
allocating
alocação ou a
the
construção de
reservoirs and
tanques ou
tanks
alocação de
through
reservatórios
partners
através dos
or the ministry
parceiros ou mesmo
itself,
através do próprio ministério, para
which
permitir
will
que as escolas possam
enable
sempre ter
schools to have
suficientes para
containers
conservar
to
água e
um,
poderem usar sempre
conserve
que
water
seja
and use it
necessário.
whenever
E
necessary.
também a questão da
Because the issue
partilha
of sharing cisterns or wells
desses
that are
poços que são
open
abertos
to
às
the
comunidades,
community
muitas das vezes
often does not help
não
because
ajuda muito porque
one
não se
have to
partilha
share with
com
the community itself.
a própria comunidade. E também
We
sempre
also
tentamos
always try to promote
promover
those
princípios
basic
básicos
tip-tap
do
systems
tip-tap,
or buckets with taps
de baldes, que é para de
to
torneiras, que
see
é
how
para
schools
ver
can continue.
como é que as escolas podem continuar. Mas
But this
este
strengthening
apoio
of
que estabeleceu para a aquisição
capabilities that happened for the
de
purchase of
materiais de
hygiene and
construção de
cleaning
limpeza
materials
também foi orientado
was
para que as
also
escolas anualmente recebem um fundo que é chamado de apoio
direct to
direto.
schools because
E
this
neste apoio
receive an
direto às
annual
escolas,
fund called
para além
direct support
da
to
aquisição
schools.
dos materiais
And
imprescindíveis
this
para a
direct
escola
support to
poder
schools
trabalhar com
is
suas
used
aulas,
for
nós
acquisition of
orientamos, se
materials
orienta
that are indispensable
para
for
a
teachers
aquisição
to
de
be able to
outros
work in the
materiais que são
classrooms.
importantes. E é
There
aí
is also a
onde
percentage
nós
that's used
sensibilizamos as próprias
for the
escolas para
purchase of
garantir
other
a
materials that are
utilização, para
important.
garantirem o javel em quantidades que possam ser
And
suficientes
also disinfection material
para
that's
as escolas
sufficient
poderem garantir
for the
a sua
schools to
limpeza. Mas
operate. But
ainda constitui desafio e
this
falo
is
aqui no
still a
meu papel para
challenge
tentar ultrapassar. Muito
that
obrigada, não sei
was
se consegui
trying
responder
to
a
overcome. I don't know if I have responded to your question.
Yeah, muito obrigado. Absolutely. You have. And I very interesting that you talk about the challenges. And in the beginning, at least this is how I was understanding it, there was a lot of focus was left for the schools to manage Washington schools. And perhaps what I've seen or understood from the situation is COVID brought in more government engagement and direct government engagement in schools, but at the same time, also still encourage the family and community involvement. Have I got this right? Would you say then that in essence, COVID has actually has improved the situation, or do you think it's challenged the situation? What is your thought about that?
Well, you got that right. I said that COVID came to wake us up. It's one of those evils that came to for the good. Because I can say that because we all know that one of the main prevention measures for COVID, apart from the issue of masking, distancing, is hand hygiene, hand washing. And for us to ensure hand hygiene, inevitably we need to have water and good sanitation schools. With the emergence of COVID, there was the closure of schools, and this closure was more of a measure to prevent these problems for children and also to prevent them from being able to mobilize every day to the schools. But during this period when the schools were closed, we as a sector were working to see what conditions we could guarantee or could ensure so that children could return safely to school. Therefore, we surveyed these conditions in our schools and we saw that this intervention was necessary. That's why we produced this contingency plan in which we reported, in addition to the pedagogical conditions that should be taken into account, the infrastructural conditions. We saw the issue of water and the issue of toilets, which is to ensure that if the child goes to school, he can ensure that his hands are clean and that he has a safe space to meet his physiological needs. Therefore, based on this survey, we saw that some schools needed to be rebuilt or rehabilitated, and others needed to be built. And when this concern was brought to the government through the highest forum in the country, the Council of Ministers, which is presided over by the President of the Republic himself, it was automatically approved that it was this, and it was decided this intervention should be made so that schools could have improved conditions. That's why we say that COVID-19 was a necessary evil that woke us up, and that now that we are benefiting from these interventions that took place because the water and sanitation condition in our schools have improved or are improved because unfortunately not all schools were intervened given some limitations, but we try to prioritize secondary schools, then primary schools, and now also technical and professional schools that are also having benefit of these interventions thanks to COVID itself. Thank you.
What a beautiful way to say it. A difficult blessing. And it is the irony of things that a situation of a global pandemic would lead then to this, but perhaps the idea that it was actually the strength in that led to the advocacy and the measures. So I want to first just thank you, Dr. Arlinda, for the excellent presentation and sharing a little bit about the fantastic work that is being done in Mozambique. And I also want to thank the teams that you work with. And I think you really raising the profile. Now, we are a little bit late, but I don't want to lose the opportunity. I don't see anybody. Yeah, sorry. Please, Dr. Arlinda, thank you. And thank you to the panel.
Well, I was also thanking you that we are grateful for the opportunity to share with the world our experience of COVID, but stressing that the challenges still prevail because we have to do everything to ensure that our children not only do not get infected by COVID, but also that schools is not the focus of other endemic diseases. and everything else. And we have to do a continuous work and always count on the unconditional support of our partners to respond to this cause. That is the welfare of our children so that they can learn in a healthy way. Thank you for the opportunity.
Yeah, thank you too. And I think you, as you said it, it's not that the situation is perfect, and still support is on both sides still required. However, I think both the Ghana presentation and taking a little bit from Ana Marica's comment, the government-led intervention shows the strength of the government taking the leadership, Ministry of Education taking the leadership, and that's very important. So then when assistance does come, you know it goes to the right places and it's effective. And I think this is the story. But yes, the situation is not over. The difficult blessing provided the impetus for government leadership. We're very appreciative of that, but this support continues, and we hope that partners continue. And I think sharing this also is one great way to ensure that you continue to mobilize the support. So thank you very much. So with that, we move to now Kenya, and I'm just wondering if there are additional questions, please post them in the chat box, and the Mozambican team and Dr. Linda and her team can respond. So I guess now we move on, and I just want to say is we move on now to Agnes. So can we get the presentation back on the, thank you. Great. So I don't see her, but I know she's there. Agnes, I see Tomohiko. So Agnes Makanyi is joining us. She's a UNICEF Kenya WASH specialist. And Agnes and I have probably now known each other for, oh, we're going on almost since 2020. And believe it or not, we've never physically met, but I feel like I know her like a WASH sister. But she is a Kenyan national. She has a master's degree in water and waste engineering from Loughborough University in the UK. She's got a bachelor's degree from a civil engineering from the University of Nairobi, and more than 22 years professional experience in WASH programming. She is currently the UNICEF Kenya WASH specialist, and functions in many areas, of course, being WASH in schools. So thank you, Agnes, and welcome. Can we hear you and see you? Or can we hear you?
Thank you, Belinda. Let me put on the...
Okay, we can hear you. It's fine. I put on the screen, but it's long. Oh, yeah, good. So no problem. I'll put on the screen, but I just want to make sure you're with us. And so
Yes.
glad. I say to you, you're my WASH sister, because we talk to each other. We're collaborating, but we never get to haven't physically met each other. But I'm really impressed with your work, and very thankful that you could take some time on behalf of the government who couldn't make it to do the presentation today. You're able to do it, and we thank Lydia and also the director in this regard. So I'm going to share the presentation, and there's a little bit of, I think yeah, great. So we're going to share the presentation, and actually we're going to do a little bit of a back and forth questions. And thank you for working on those questions with the Ministry of Education. So the first question, I guess, was really to understand what is the enabling environment of WASH in schools in Kenya.
Thank you very much, Belinda, for this opportunity and the introduction. Yes, we have known each other now for some time, and I also love working with you. It has been great. So thank you so much. You are working like a Kenyan already, so thank you very much. Yes, so about the enabling environment in Kenya, I'll start off by just first briefly highlighting the situation in Kenya. In Kenya, we have around 72% of schools with access to basic drinking water services, and around 50% have access to basic sanitation facilities, and around 2% with access to hygiene facilities. So as you can see, it's quite low in terms of sanitation and the hygiene in the schools. So although this was data for 2020, we hope it has improved a little while with the COVID As the other presenter said, thanks to COVID, we have had some improvement in the area of wash in schools. So we hope the situation is better in the schools, and we are really working hard to get the latest data by the end of this year, which will give us the real status. But in terms of the sanitation and water supply facilities, you find that in most of the schools, they don't meet the latrine ratios of 1 to 25 girls and 1 to 30 boys. So you find that more boys and more girls are sharing the facilities. There's congestion in these facilities and also lack of continuous supply of water, because these schools are mainly in the rural areas where even the communities do not have access to water. But let me come back to the question in terms of, and before I leave that about the situation, also in terms of access to menstrual hygiene and health, the girls still lack adequate sanitation facilities in the schools. So you find there's no privacy, you may not lock the facility well, so girls during menstruation, it becomes a challenge for them. And the government of Kenya is providing sanitary pads for the girls, but this is only for the time they're in school. So when they're out of school during vacation, it's also a challenge. And the disposal has not been fully addressed in the school. So this becomes an area where, as development partners, we are working with the Ministry of Education and other partners to see what solution we can be able to offer. So the issue of menstrual health and hygiene is still a key component with the Kenyan government, and we are happy because it is part of the Basic Education Act, where the government has committed to provide these sanitary pads to adolescent girls, and they have a yearly budget which supports these girls in schools. So in terms of other components of the enabling environment, in addition to the Basic Education Act, we have the National School Health Policy, which was amended in 2018. And this is where the wash in schools is anchored. So we don't have a standalone wash in schools policy, but wash in schools is one of the thematic areas. There are around 8 thematic areas under the school health policy. So this is where the wash in schools is underlined, outlined fully on what we do on the area of water supply, sanitation, hygiene services, and capacity building of the communities and schools, sustainable management of the wash facilities. And we also have a chapter clearly indicating on the menstrual health and hygiene in Kenyan schools. So this gives us a good enabling environment to be able to support menstrual hygiene and health in the schools. And then we also have the Kenya Environmental Sanitation and Hygiene Policy, which is anchored under Ministry of Health, and this one also outlines clearly what we should do in the schools in terms of sanitation. And actually, Ministry of Health takes lead in coordinating wash in schools activities by co-convening this with the Ministry of Education. And so they also have wash in schools coordinators at the county levels and at the national level. So this really strengthens the enabling environment in terms of sanitation and hygiene in the schools. And then we also have the County Environmental Health and Sanitation Bills. We have the Water Act 2016, which outlines that the county governments are responsible for water for communities and also schools. So we use this to lobby with the county governments to be able to extend water to schools. Then we have the Public Health Act, and this one outlines clearly what should be done in the schools. And it is very important, even before new schools are registered, that they meet the Public Health Act requirements. Then in terms of menstruation, we have the menstrual hygiene management policy and strategy, which really, yes, has gained a lot of praise in Kenya and internationally, because Kenya was among the first countries to embark on a policy on menstrual health, hygiene and management, and a strategy. And this is already approved and launched, and we have already been disseminating to several counties in Kenya. And so this policy and strategy for MHM, we have worked on with the government to prepare menstrual hygiene management handbook and also hygiene promotion handbook for teachers, which have also supported the teachers now on how to deliver menstrual hygiene management information and hygiene promotion in the schools. Thank you. Over to you, Belinda.
Yeah, thank you. And then, so then I think you've gone through them already, but something maybe more specific to the WinS. Sorry, I'll put my video back on. Specifically more to WinS. Can you share some of the guiding documents that are just really focused around Washington schools and WinS? Because we've created very nicely the enabling environment in terms of school health through the health and the Wider Education Act, but now coming a little bit closer to Washington schools, what would you say are the key guidance documents that would be
Yeah,
used?
thank you very much, Belinda. So in terms of now washing schools being anchored under school health policy, the government has led development of standards and guidelines for water, sanitation, and hygiene infrastructure in the schools. So this guide or this document has outlined key standards and key designs and the guidelines also on sustainable operation and maintenance in schools to guide any partner who is implementing a WASH program in schools. And these standard and guidelines is signed by the three ministries of education, Ministry of Health, and the Ministry of Water. And it has also a scorecard, which is more close like the three-star approach, which guides the schools on how they can do their own self-assessment on the situation on WASH. They score themselves, and with that score, they can say, are we doing well or not doing well? And then put in recommendations on how they can be able to improve their situation in the schools. And then further to that, we now have the menstrual hygiene management handbook, which I've mentioned for teachers, and the hygiene promotion handbook for teachers, which now guides the teachers in terms of menstrual hygiene management for girls and boys, and also the hygiene promotion for school children, where the teachers are properly trained on how to roll out this in schools, and also to form school health clubs, which then work with the teachers to be able to reach out all the children in the school in terms of appropriate hygiene practices. We also have the life cycle costing guide, which is also interpreted with the standards and guidelines for WASH infrastructure, and also a costing tool which has been developed with support of Emory University. And this life cycle costing guide looks at all the costs from capital cost to operation and maintenance cost, all the recurrent costs involved, not only the initial capital cost, to make sure that we are fully funding for the full costs involved in maintaining this facility. So these are useful guidelines which are helping us in the area of WASH in schools, and currently we are working on the WASH in school strategy and the costed action plan, which has already been validated by the stakeholders, and we are now finalizing it for approval by the three ministries again, so that they can be fully committed on how to roll it out and implement in schools, just to indicate a roadmap on where are we in terms of WASH in schools, and where are we heading to, and what are the strategies we are putting in place to get to that point. Thank you.
Yeah, thank you very much. It's again amazing the amount of resources that are available. And then the question would be then next one around implementation arrangements. When you have these materials, how do you work? How do you how is it in Kenya to have the ministries work together? So what are kind of the implementation arrangements? You did mention that all the documents are sort of checked by three, but I guess maybe more specifically to implementation arrangements around maybe monitoring, WinS monitoring. How would the three ministries work together, or how is this managed?
Yeah, thank you very much, Belinda. Yeah, the area of monitoring is actually one of our areas when we did a bottleneck analysis, which is one of the areas we need to strengthen for WASH in schools, to strengthen the data we have. But the WASH in schools monitoring is anchored under NEMIS, the National Education Management Information System, managed by Ministry of Education. And under Ministry of Education, we have the Directorate of Basic Education and also the Quality Assurance Department. So they are those departments now responsible for monitoring what is happening in schools in terms of WASH facilities and hygiene services. And they coordinate with the other ministries, Water and the Ministry of Health, through the WASH in Schools Technical Working Group, which is chaired by Ministry of Health and the Ministry of Education. And so in this forum then, all the other partners, also the development partners, the private sector, they are brought on board to understand the situation in the schools and the gaps, and how they can come in to fill in the gap and the data in schools. So that is how we have been doing it. And we also have the school health committee, and this one is at the level of the school health now, the policy level. So it looks at broad aspects: wash, health, nutrition, child protection, environmental safety. So that one looks at the broader aspects, but the WASH in Schools Technical Working Group then coordinates any issues around the WASH in schools, and the monitoring aspects is led by the Quality Assurance Department and the Directorate of Basic Education and the Minister of Education. So these national and county level quality assurance officers and the Minister of Education, they visit the schools. So as they are looking at the curriculum implementation, they also visit the infrastructure, the WASH facilities, and they assess and then give a recommendation to the Board of Management on how to be able to address any issues which have been identified during their visit. So that is the structure. And also Ministry of Health, they have the school health coordinators based at the county level, then who also now give support to these schools, especially on hygiene issues and sanitation issues in the schools. Thank you.
Yeah, excellent. It's very interesting. So you have you have a broader school health committee, national level and various levels, and then you have more specifically a WASH in schools, sort of a technical working group. And then you've also got the link with the quality assurance officers working with at the school level with the boards of management. So you've got at various levels, you've got the structures there, which is very coordinated. Now speaking a little bit around monitoring, WinS monitoring, can you tell us how WinS is monitored? But I mean, maybe specifically talk about how the data is used and maybe even what are the future plans. You alluded to it a little bit with the WASH scorecards and then the NEMIS and some revisions, but maybe you can elaborate a little bit more on WASH in schools monitoring.
Yeah, thank you. Thank you for that question. So in terms of monitoring, since last year around December, we have been supporting Ministry of Education, Quality Assurance Department, and the NEMIS department. So we came up, just giving them guidance, they came up with the WASH in schools indicators, which are aligned to JMP. I think we came around 17 questions, which are aligned around all the components of WASH. And these questions are pulled from JMP because we want this aligned to global reporting so that whatever information we are collecting, then it is aligned to the JMP report. So with the NEMIS team, these questions were uploaded to the real-time monitoring information system and an NEMIS so that the 8 teachers can be able to fill out this information so that we can get the WASH situation in terms of all those components of WASH. And we further worked with the team to come up with a WASH manual because we know the quality assurance officers are not technical in the area of WASH. So how can they understand what is a functional toilet, what's a functional water supply, what does it consist of a school health club? So we developed a WASH manual for which the quality assurance officers will be taken through to understand what the WASH involves and how they can be able to monitor that in the schools. Now, with those questions and the WASH manual developed, and also a WASH tool was developed for the quality assurance officers to do a detailed assessment in the schools. So they have the NEMIS indicators, which will be filled by the 8 teachers, which are just straightforward, like what is your main source of water? Is it functional? Is it reliable? Then we have a detailed WASH tool, which will be used by the quality assurance officers as they do a detailed assessment in the schools. And this will give us an in-depth situation. In fact, it's ranked from around 1 to 5, so it's close to the scorecard we have. So this will be giving us where is the school lying, what is the situation in the school, and clear recommendations on what the school can be able to take it up. And then now the next step, which the Ministry of Education is planning, is to take through the quality assurance officers from the 47 counties through training to understand this NEMIS WASH in schools indicators and the WASH tool and the WASH manual. And then they can roll out this to the 8 teachers. They cascade this to the 8 teachers to understand and even do a practical for them in the school so that they fill in the correct information in the NEMIS information. So by the end of this year, we are hopeful that we should be able to get current information about the WASH situation in the schools, and we are very excited that the Ministry of Education has taken this, and because already the NEMIS is real-time monitoring information system. And further, actually, I think Belinda, I not updated you on this, with Ministry of Health, We are also working on a real-time monitoring information system on sanitation and hygiene indicators. And they will also be collecting information on schools and healthcare facilities. So we are trying to think of how to link the two. The NEMIS and the real-time monitoring information system for Ministry of Health, which is under development, to see which one would be comprehensive to feed into the other. So that's a discussion we are doing between Ministry of Health and the Ministry of Education to see which one to be filled and which will now link, so that we have a linkage for both of them and others like DHIS, where you can be able to get comprehensive information on what situation in schools, healthcare facilities, and communities. Thank you.
Yeah, it's very interesting about your the monitoring arrangement, and it's, you know, again, Kenya is leading the way in this area, to actually look at how education and health can have the same to be integrated, or at least collaborating in the data sets. And it actually reminds me of the last webinar we had with Indonesia, who is actually is in that process or has developed that process. So I do think there's lots of learnings back and forth, but very interesting. Now moving on to capacity building efforts. I know we're a little bit over time, so we do appreciate people to stay on, and those who have to go can go. But I do feel that the conversation is quite good. If we just go through the capacity building, you shared a little bit about what's happening with the training on monitoring with the quality assurance officers. But do you want to say anything more on that in terms of WinS and capacity building?
Yeah, just to add on to that, in further to building the capacity of the quality assurance officers, we will also be building the capacity of the teachers on the hygiene promotion and the menstrual hygiene management, because in Kenya we have over 32,000 schools. So we have to think of a strategy of how to scale up the issue of hygiene promotion and menstrual hygiene management in the schools. So by reaching out to the teachers, then we'll have reached all the schools, and considering that we have the competence-based curriculum where hygiene education is taught in the schools, then this will really enhance the hygiene education. And further, in terms of monitoring, we have the boards of management who are responsible for the sustainable operation and maintenance of the wash facilities. So we're also planning on how this can be scaled up through the quality assurance officers and the education officers, and also the Ministry of Health team, on how they can sensitize the BOMs to be able to prioritize wash in schools so that their capacity is built in that area. So in the trainings, we have the regional team from education and health and water, and also the county level team. So they will be all capacity built so that they can cascade that to the school level. Thank you.
Very interesting. So now we move on maybe a little bit to budget, and again, very fascinating about the level of capacity building. And I'm also probably lots of questions on this, but I'll move along about how that it's also linked to the competency-based curriculum, and I think that's also important. So it's just not a standalone, but it's very much a training, but it's also integrated in the curriculum, and I think you've shared that nicely with us. So now on to budget and financing. Is there a standalone budget for WinS? And I don't know if maybe through the COVID pandemic or through others, has there been more momentum to release more money for WinS through the central government? Any sort of reflections? First, the quick question is there a standalone budget for WinS? And if not, what are the funding sources? And has there been more funds released as a result of COVID-19?
Yeah, thank you very much. Yeah, the government through Ministry of Education has really been focusing on improving infrastructure in schools, because we have 100% strategy which the government is advocating for children to move from primary to secondary school level. So to enhance the infrastructure, the government has been allocating a high budget for secondary schools. So for secondary schools, I would say the infrastructure is getting better, because they have an high allocation for infrastructure, which includes the classrooms and the toilets. But for primary schools, they still have the budget they are getting per pupil. We have a free primary education fund, which is given to the 8 teachers to their accounts to be able to manage the schools. And the government of Kenya subsidizes education in schools. So in terms of a standalone budget for secondary schools is there, and also for primary schools is there. But what we have is a small component on per capita for each pupil. So we have a general account which is given to the schools, and in this general account, they have a budget line called for repairs and maintenance of infrastructure. So this includes the classrooms, the toilets, kitchen, and so this one is allocated around 21 Kenya shillings per pupil. So this one they can use across the board. So it's not specific to wash, but it includes the toilets there. And then there's another one for electricity, water, and conservancy, which is around 15 Kenya shillings per pupil. So this one, again, they can use to pay the water bills. And then we have another one for sanitation, environmental sanitation, which is around 13 shillings per pupil. So when you compute that, it gives you around 31% related to wash, but not exactly specific to wash. So the only budget specific to wash is on sanitation, which is around 8%. So at the advocacy, so that gives us around 50 shillings per pupil for what is related to wash, and only 13 shillings of what is specific to wash. So the advocacy effort here is for an increase in the budget allocated to wash in schools, and to separate the one for repairs and maintenance, so that the one for wash is exclusive, the one for classrooms is exclusive, because they normally prioritize now the classrooms instead of the toilets. And then the one for water also is combined with electricity. And now with digitalization in Kenya and use of the laptops, then you find the electricity bills going up. So now to supplement what the government is doing, actually the government has been having the largest budget in Kenya in education, and I would say it has grown to a higher level. And even during COVID, the head teachers were not given a different budget, but they were asked to prioritize getting hand washing facilities and soap to the school. So this really enhanced the issue of hand hygiene in the schools. So in addition to this, now the schools normally reach out to the parents to supplement this budget, and other development partners like NGOs and also the UN and the private sector through the corporate social responsibility to be able to supplement what the schools have. Thank you.
Yeah, it's super interesting. And I do appreciate that there's a per capita per student budget, but I imagine in a situation, I mean, you're dealing now with the drought. And so I appreciate your time, because I know many of the partners are dealing with, the COVID pandemic was there, but now you're dealing with another problem with a major drought in East Africa affecting schools. And I know you're actually in quite involved in that right now. And so I appreciate your time to speak to us today. But when you think about a situation like that, a per capita budget for a rural school in a drought affected area, which has fewer children, but the needs are very high, the cost to transport things are very high. That kind of probably still, it's nice that they have the budgets per child, but it doesn't favor perhaps maybe remote schools, more challenged schools in that situation. But I'm sure there's lots of comments on that too. So maybe moving along around the issues around sustainability, can you tell or share some of what you would see are the major challenges of sustainability, and how should partners and Ministry of Education address this? And then we'll go into the last question. Thank you.
Yeah, thank you. Yes, sustainability is actually one of the key challenges which we have around the washing schools, and mainly is on the poor operation and maintenance of the facilities. The sustainability bit of it, once the facilities are done, and this is mainly because we don't have the life cycle costing for these facilities, because once the partners come in or the parents come in, they construct the facilities, but there's no budget allocated for operation and maintenance, except what I have read out in terms of per capita. And as Belinda pointed out, yes, it really does not favor those schools in the rural areas with a very low population, because a school can have 200 children, so you can imagine what they will get out of that. So the operation and maintenance and the sustainability of these facilities is the biggest challenge we have. So you find the facilities in disrepair, no doors, they cannot be locked. And this becomes a key challenge. And then again, ensuring sustainable access of safe water to the schools is a big challenge, because these schools are in the rural areas, and as you mentioned, we have drought now, and over 80% in Kenya is in the arid and semi-arid lands. So the communities do not have water. That means the schools also do not have access to water. So it becomes a challenge to get water to clean the toilets and to get water for also hand washing. And then in terms of monitoring, although now it's better, we used to have the education officers just focus on curriculum and performance. But now with sensitization and involvement of other actors, now they are going ahead and checking on the facilities. So that's an area which needs to be strengthened. And then data is a key challenge in terms of evidence for the wash situation in schools. We have supported the government to do a mapping of schools in around 4 counties, but that's out of 47 counties. So to get the data on the wash situation nationally, that becomes a challenge, and it's very key for proper targeting, for proper implementation and allocation of resources, even for the ministry itself, because now they just give a flat rate per pupil, but if they would be guided by clear evidence to know this school is in dire need of this, then they will be able to spend the resources more wisely. So those are the key challenges which we have around that. And also we have the enabling environment, that's the policies, but dissemination and enforcement is a key challenge. You find them in the shops, although now the Ministry of Education and Health are getting out and using that in any forum they get, they are now disseminating the key policies. So through this sensitization now, they are picking up, but I would say that if they are fully disseminated, then this will enhance the enabling environment and improve the wash situation in the schools. Thank you.
Thank you very much. And then now on to the very last question of the day as we close the session. I've asked this of all the presenters. How has the COVID-19 situation either improved or challenged? And this is your personal reflection, so it doesn't have to be based on any science. But if you kind of reflect on the Washington school situation, you reflect on COVID, and if you even want to reflect on the drought situation, cost of living, all the the global situation which impacts it. How has this plus or minus Washington schools?
Yeah, thank you. Yes, I would say like the other presenter, thanks to COVID, there was a lot of sensitization and awareness creation in terms of wash in the community and wash in schools. And for the first time, you would go to the schools and you find hand washing facilities and soap placed outside each classroom, and also next to the latrines, and next to the kitchen. And we also worked with the Ministry of Education, Ministry of Health and Water, and we came out with the guidelines or protocols around COVID-19 on school reopening. And it was very clearly stated for a school to be reopened, this is a checklist to check. It was stated the minimum amount of water available per school, the number of toilets available per school, and washing facilities, and it was very much detailed. So I would say that although the schools from the government did not realize increased funding, but from other sources, more partners came in to support the schools, to provide hand washing facilities in schools, to provide soap. There was a lot of sensitization in the media, social media, in the TV, in the radio, and everyone was talking about hand washing with water and soap. So for the first time, there was a lot of emphasis on issues of hand washing, and Ministry of Water also came in to drill boreholes. Some were drilled in the schools and some were drilled in the informal settlements in Kenya, and they were doing free water tracking to the schools and to the communities to be able to access water for hand washing. So I would say that it improved, but then again, the challenge was sustaining these facilities, because if you go to the schools now, most of them now are broken, they need repair, and that is the biggest challenge we have in terms of sustaining the hand washing facilities and the soap. But the schools were really asked by the government to make use of the funding they have. The alumni came in, they supported the schools in terms of soap, in terms of hand washing facilities, and in terms of improving the water storage in the school so that they would get a place to store the water they were getting from the government or from other supporters and other partners. So I would say that really COVID enhanced the importance of wash, especially hand washing with water and soap, and we know this one contributes to reduction of about 40% of wash-related diseases. So I would hear parents say, "Oh, my children are not getting sick nowadays," and I told them, "Yeah, this is related to the hand hygiene we are practicing," and the children would come home and they're reminding their parents. So we remember that children are agents of change. So this information they would get in school would also be taken to their parents at home, and they would practice the steps of hand washing. So I would say COVID, although it was really a challenge, but in a way it enhanced the hygiene in our schools. Thank you.
Thank you so much. And what a nice and positive way to end it, Agnes. Thank you so, so much. Asante Sana, on behalf of the Washington Schools Network. There is some questions on the chat box. And because we have gone over time and we can't, but if you can take a minute, make yourself, maybe perhaps to Mahiko and others from Kenya can help answer some of the questions or comments if there are. I will then stop our share. And again, thanks you so, so much for a very insightful, full, really sharing of the rich work that is being done in Kenya on all of the enabling environment fronts. So thank you. And I think I pass it back to you, Marge, in the Philippines, as we maybe you can put back the presentation as we kind of close out the session. We appreciate we went over time, but I think you agree with me as well that it was interesting and there was, I didn't want to end it. And I think we have so much that we've learned from this. So I think we can just close now. So the insights I've shared already, just to say that in all cases, we learned a lot about more government-led interventions, and we had two great presentations. They showed comprehensive and how it's integrated. And I think I leave with that. Sustainability remains a challenge. And that goes back down to, I guess, advocacy and commitment, but I think that we are on the right track. So I would like to thank all the presentations today, the questions and the answer. And now I pass it on to you, Marge, and thanks so much. And also I want to thank WaterAid and letting us use your platform today with the translation. It's been super, super useful. So thank you. Good. So Marge, over to you.
Thank you very much, Belinda, for your, as always, your excellent moderation of this lively discussion and for that excellent words to wrap up our session. And to all our presenters, starting with Ellen, then Dr. Erlinda and Agnes, thank you so much for the rich and insightful presentations and for sharing the experiences from your countries to the audience that we have here today. And echoing Belinda's gratitude to WaterAid, to Maya and colleagues, they've all been very supportive and have tremendously helped make this session possible. Thank you so much. And of course, to all of you here today, thanks for participating, for sharing your insights, for posting your questions in the chat, and for staying until the end of the session, despite us going over time. Just a few housekeeping reminders from my side before I finally let you go. The WinS Network will be hosting another webinar on the 30th of June, Thursday, same time as our session today, as part of the Chat, Listen, and Exchange webinar series. The session will be around hand washing facility designs that were promoted and distributed to schools during the course of the COVID-19 pandemic. In that regard, we would be very happy to hear from you on what your thoughts and feedback are on this session, as these would greatly help improve the upcoming session. We would like to request you to please take 2 to 3 minutes of your time to respond to the short feedback form, which you may access by scanning the QR code on the slide or the link which I will post in the chat. Shortly, I will also follow up with an email to all of you to share the same link to the feedback form, and we'd really appreciate your response. Again, many thanks in advance, and we look forward to seeing you in the next webinar. Once again, on behalf of the WinS Network Secretariat, thank you very much for your time and attention. And yeah, I end here. Bye, and thank you so much. Please enjoy the rest of the day. Bye, everyone.